Welcome to TractManager, the healthcare industry's leading provider of strategic sourcing and contract lifecycle management applications. Two great divisions, MD Byline and MediTract, make up TractManager, which provides critical drivers for operational efficiency, cost reduction, and contracting compliance to 60% of the nation's hospitals. MD Byline provides hospitals with strategic sourcing data and advisory services in purchase services, capital equipment and technology, and consumables. MediTract provides hospitals and non-acute care facilities with an enterprise contract lifecycle management solution that automates workflow and increases contracting compliance. Together, they can help your hospital effectively and compliantly manage the journey of contracts throughout your enterprise. The journey of every contract begins with a need. Someone in your service line will require a purchase, a service, technology, or other form of contract. Following whatever internal protocols have been designed, they then make the request for a new contract within MediTract's Process Manager, our automated contract workflow solution. Typically, this involves a needs assessment form, depending upon the type of contract. As the contract makes its way through the approval process, Process Manager enforces any established internal protocols to ensure compliance. This both automates and streamlines manual tasks, resulting in increased efficiency. The question then becomes, how much will this cost? Using the Strategic Sourcing Suite from MD Byline, Materials Management will research an initial price range for the item. Depending upon whether the purchase is for capital, consumables, or purchase services, different sets of purpose-built tools are available. As the price range is narrowed, an internal business case is developed and discussed, ensuring the purchase aligns with budgetary and strategic goals. Depending upon the price of the item, your internal processes might dictate that the contract go out to RFP. The question then is, can we get a better price? Using the benchmark data from the previous phase, a request for proposal can be designed, published, evaluated, scored, and awarded in our automated expert RFP solution. This time-saving tool includes pre-built RFP templates by category and the ability to compare vendor responses side by side. A one-on-one consultation with an MD Byline clinical advisor can help with negotiation strategies. Other tools, such as user ratings, contract benchmarking data, and specific clauses governing terms and conditions, will help you enter negotiations armed with the data you need to succeed. Expert RFP allows you to assert and maintain control of the medical capital acquisition process. After vendor selection, the next question to answer is, who else needs to be involved? Your selected vendor is wed to a contract template within MediTract's Process Manager, and the contract requisition or approval process begins. This is where much of the work involved in shepherding a contract to execution occurs. The data collected during the approval process, things like terms and conditions, dates, rates, and more, can be mapped as fields into a contract template within Process Manager. As internal approvals and sign-offs from finance, service lines, compliance, and materials management all occur, you control which steps trigger specific actions within the platform. Essentially, Process Manager forces actions, notifications, or sub-workflows to occur based upon your unique business rules. Once the contract has been vetted throughout your organization, the digital signature capability captures and stores all required approvals from both vendors and internal stakeholders. The contract then enters an activation state within Contract Library. It's also important to know if you're realizing the true value of the agreement that has just been negotiated. This requires continuous monitoring of the contract. Our vendor payables solution can compare actual accounts payable spending to your contracted amounts. In this way, elevator discounts, expiring equipment, warranty renewals, and recalls can all be managed via triggered alerts sent from Process Manager or our purpose-built recall management tool, Recall Tracker. You also need to know how your vendor is performing. Our virtual vendor evaluation form allows hospitals to evaluate and score vendors for compliance with internal and external regulations. This digital questionnaire is linked to every contract your vendor has signed. In the event of an unsatisfactory evaluation, an automated workflow can be initiated within Process Manager to address it. If your hospital outsources a service, you're using a purchased service. Any contracted services performed by third parties are purchased services, and they span departments across entire health systems, including clinical, financial, environmental, and support services. Our purchased services experts can compare your optimized outsourced services spending in any category to our broad base of healthcare providers across the country, identifying areas where savings can be realized. These opportunities are prioritized and weighted in our opportunity assessment, which gives your team a roadmap for how to optimize outsourced services spending over time. Eventually, we're back to square one. Whether due to a renewal or other triggered action, Contract Library initiates a new contract cycle within Process Manager. In a continuous and automated loop, TractManager's strategic sourcing platform thus ensures maximum savings, efficiency, and compliance, both with your own internal protocols and external governing bodies. Thank you for taking the time to understand TractManager's strategic sourcing and contract lifecycle management solutions. To learn more, attend an informational webinar, or see a product demo, please contact us today.